Okay, good afternoon, everybody. I think we can maybe slowly start because we have a couple of slides to present before we go into the Q&A. So happy New Year, everybody, and welcome to the first Q&A clinic for PMS. Just a bit of the agenda and the keep notes that we always have. So we will be covering the upcoming events and also the documents that we are going to be updating. I will give you a short overview of the known issues and the actual fixes that we've done this week, and then we can jump directly to the Q&A session. So a bit of the housekeeping note. So as you know, this session is going to be recorded and we will make it available through the EMA YouTube channel and also in the EMA, the event webpage. You can use Slido to ask your questions and also to add both, which are the questions that you would like to get the reply for, and also as the interaction tool with the audience. The interaction with the Slido is voluntary. You may opt to be to remain anonymous, but if you use the Slido, then you give us your consent on the processing of your personal data, as it is stated in the data protection notice for Slido that you have in this link. Um, a bit of the upcoming events. So we have already planned the Q&A clinics for PMS, for XMPD, and for SONR for the first half of the year. So you have here the dates. You can already register on the event page, so you can blog your calendars and join the different sessions. And also 28th of January, we have our first SPORE and XCBMPD status update webinar. You know that we have 4 throughout the year. So the first one is going to be on the 28th of January. You can also register and the event webpage is already available. Important news that we have for this week. So as of today, we have this general issue that we had for the packages that were transferred in XMPD, and most of those packages were not reflected in PMS and in the API and also in the product UI. So we had this example where we had 3 packages in the product UI, but actually in the so if you see this package product definition with this ID 128, instead of being one package, it's actually had like multiple EV codes linked to them. This issue has been fixed. Now all these packages are reflected in the API and are also created in the product UI. You can see them. So if you have one of those products impacted by this issue and you have a ticket opened, it would be great if you can go and close the ticket, because this issue should have been fixed now. So if the issue is fixed and you still have a ticket open, please go and close the ticket, because it will help us with the management of the backlog that we have. So these are big news. Like, we have this new general issue is now fixed, and this shouldn't happen anymore. Then also, because maybe we will have the question in a Slido, the ATC code report. So we know what the issue is. We also said the last Q&A session that we had last year that this is going to be fixed beginning of this year. So we are just waiting for the publication team to update the critical medicines Excel. So this Excel with the ATC codes and the route of administration. So as soon as this Excel is updated, is published, the BI report in the product UI will be fixed and it will be working. It should happen maybe next week, the latest. We are just waiting for the team to publish the Excel. So keep an eye on the reports. There is a banner also in the product UI. This issue is going to be fixed. So I think now here you have the QR code for to join the Slido. You also have the hashtag PMS QA 1301, so 13th of January. you can join and I will be replying to some questions. There are already questions in the Slido because this morning we had the SOR Q&A and there were a couple of questions from PMS. I have replied in written to those questions, but if you also want to hear a bit of more explanation, I can also give it if there are no other questions, but I assume there will be some questions there. So I think, Vivian, over to you. You're going to share the Slido.
Perfect. Thank you very much, Marcos. Okay, so you should be able to see my screen. Okay, perfect. So let's start with the first one. Okay, so in case we identify a modification correction to be made in PMS, should we prefer opening a ticket through the desk, the service desk, or should we make the correction in XCV MPD in order to reduce the number of tickets in the service desk?
Yeah, so if you see that the error is on a non-cap or in a field that is coming from XCVMPD for caps, then ideally you can correct it directly in XCVMPD. You don't need to open any ticket. If the issue or the wrong data is for a centrally authorized product and then the data is coming from Siamet, then you need to open a ticket because then we need to contact the Siamet colleagues and they need to perform the change. So yeah, if you can do it in XCVMPD, by all means, you can just send the data to XCVMPD and it will be fixed.
Okay, so next question. Okay. When we withdraw a presentation of a cap in XCV MPD, it is not listed as withdrawn in many cases in PMS. The EV code is available in PMS. Will this be fixed?
Well, here there are two things. One is, so withdrawn packages or withdrawn EV codes are still part of PMS and they will still be available in PMS. So this thing that EV code is available in PMS, yeah, it will be. Even if it's withdrawn, we are not removing it from PMS. It stays there. Now, if the problem is that the status is not changing, so you withdraw a presentation in XCMPD and the status is not propagated to PMS, then you need to contact us because then the synchronization is not working and we need to check why. But if the status withdrawn is there, the EV code will remain there. The package will remain there. We will not remove it from PMS.
Okay, next question. For Annex 5, Chapter 3 of XCV MPD, non-caps not in ULCM don't need to submit separate pack sizes. What happens if these are used in EIF?
Well, then you need to submit them. So in theory, so is in the chapter 3.2 of XCVMPD, there is a diagram explaining when you need to submit the packages that are part of the union list of critical medicines. And it says, one of the branches of this diagram says, if the medicinal product is authorized at the level of the package, so you have different pack sizes, different MA numbers for each of the pack sizes, then you need to submit all the pack sizes. It doesn't matter if it's a critical product or not, because this is the way that it's been done like since the beginning of XCMPD. If you have a specific MA numbers per pack size, then you need to submit all the pack sizes. And in the EAF, you will have all the packages and you can select, okay, the variation is for this specific pack size. Now, if you have only one MA number for all the pack sizes, then in XCMPD, at the beginning, it was like, yeah, you can submit all the pack sizes with the same MA number, or you can submit just one EV code. And then in the EAF, even if it's not connected to PMS, you only had to select, okay, this is the product for which I want to do a variation. And we already checked this at the beginning of PMS, like 2021 or something like this. We were wondering, hey, do you need all the packages for the EAF? And we were told that is not. Only in those countries where the authorization is granted at package level. Now, if for some reason you need the packages on the EAF, It's easy. You submit them in XBMPD. They will be available in PMS and therefore in the AF. So maybe a very long answer, but I hope it's clear.
Okay, next question. There's a specific field in PMS to capture pack sizes data, and EMA wants the package description to include pack size. So packaging plus pack size plus content. Please clarify rationale for capturing pack size info in both places, and what will be significance in the future.
So again, the package description is it's an optional field, and you can include the data as you want. You can just copy paste whatever is in the SMPC. You can include the data a bit more structured. So our recommendation is to include the pack size and the national identifier if you have it. We recommend that because it's an easy way for you and also for NCAs to then identify the packages and say, okay, this package that I have in XMPD is the one for 30 tablets. We know that then in PMS, you will need to send the 30 tablets in a structured way. You need to say it's 30 and then the field of tablets. You will need to fill it. The most important one obviously will be the one structure because it's the one we can use to analyze the data. We can get the structured data, we can perform analysis, and we can use this information. But the package description is also important. Now, I think you are mixing something here. This packaging plus pack size plus content is something that is coming for caps from SciAmed. And it was a decision because this information is from our internal systems. We need to know the content in case there is a content and the packaging, etc. But that is just for caps. For non-caps, again, you can submit the data as you want. We think it's better if you send it a bit structured. So then whenever you read the package description, it helps you to identify the package that you see. But again, we will use the one that is in the structured way, the 30 tablets.
Okay, next question. In the last Q&A, it was announced that the grouping rules will be changed for PMS migration. As far as I could not see any changes, will the procedure type be added for all countries?
Yeah, so that is something that we will be implementing this quarter, hopefully before the end of the month, but I cannot promise anything. The idea is that we will include the procedure type as one of the grouping rules in PMS. That is to support one use case where there are different products authorized in a country with the same data, same active substance, same strength, same name, same everything, but one is through a national procedure and another one is through an MRP or a DCP. So that will allow us to split products correctly instead of grouping them and grouping them incorrectly. During this year, we also want to improve some of the grouping rules that we have in PMS. So we will be announcing them whenever we have them and whenever they are implementing them. We will also be discussing those rules with the SMEs. But for the moment, there is nothing updated in the chapters or in the guidelines because it's not implemented yet.
Okay, next question. If the authorized pharmaceutical form in XCVMPD is granules for oral solution in sachet, according to D1 XCVMPD RMS EDQM pharmaceutical dose form terms mapping version 2, it should be reflected in PMS as granules for oral solution, right?
Yeah, so this is one of the ones that I've replied in written. So that was the idea when we created, or the RMS team created this Excel. But I've been checking, and the granules for oral solution in sachet is a standard term from EDQM. And the mapping between XCVMPD and RMS is done to this specific term, to the one in sachet, not the one with oral solution only. So the mapping is done to that term is a combined term And yeah, you don't need to make changes to anything, and the mapping is actually done to this term, the granules for oral solution in sachet.
Okay, next question. Is it mandatory the enrichment MBOs and structured pack size for expired MPs?
No, expired products or packages don't need to be enriched. So this is explained in chapter 3. Only the products with a valid status should be enriched. We don't need to have the manufacturers for products that are withdrawn or revoked or whatever. Only for the ones that are valid products.
Okay, next question. Each pre-filled syringe contains supersaturated solution of salt name corresponding to 0.246 milligrams of a base name per milligram of solution, which ensures effective dose per injection of 60 milligrams, 90 or 120 of base name. What strength we take in 3MP full names?
That I cannot reply with this information. So the medicinal product full name is the one that is authorized. Sorry, what is strength we take? I don't understand the question. These 3MP full names.
Maybe they can provide more info, if we're not 100% sure.
Yeah,
They want to.
actually, that would be great if you can maybe open a ticket. You provide us with the SMPC, because the SMPC will tell us a lot of how this information is included. Also, maybe the module 3 or the section where this information is described. Yeah, that would give us a lot of information.
Okay, next question. The manufacturer produces a starting material for the active substance. Which sport term should be selected in the PMS for the MBO enrichment
That
activity?
I also replied. So manufacturers of starting materials should not be provided to PMS. It's only the active substance intermediate, and the medicinal product. So in chapter 3, you have the table with the relevant manufacturers, manufacturing business operations that are relevant for PMS, and the ones for the starting materials are not there. So you don't need to provide this information.
Okay. So next question is, we have multiple organizations. I requested for all credentials for API. One works, the remaining are getting a 403 error for PMS, API, V3 medicinal product definition, domain, and then you've got the code, of course. I opened a ticket that should be fixed, but it still isn't. What could be the problem?
I think I remember this ticket, and I have assigned it to the technical team. So actually to Andre, who is the expert and the one who is granting the access to the API. So I hope he is dealing with it. I will try to come back to him. So yeah, if that's the ticket that I replied to half of the questions, and then the other questions were the technical ones, then yeah, Andre Idu, who is the platform architect, is taking care of it.
Perfect. Next question. Okay. One MP had 6 EV codes invalidated as not valid, superseded by MA renewal variation. After renewal submission, PMS shows all 12 EV codes as valid, renewed, varied MA. Will EMA correct old code status to not valid, superseded, or remove them from the PMS ID?
Yeah, we will correct this. I'm not sure when yet, but that is on our radar to be fixed. So the answer is yes.
Okay, next question. Where can I find information of pack size description to be included in Article 57 PMS? Which chapter describes the non-structured pack size description of National Code tablets material?
So let me see. I know you like these things, so let me. I'm gonna share my screen 1 second, if I can. Oh, wait. No, not this one. Sorry, I'm trying to share the correct screen. Okay, I hope you can see my screen. So if you look in Internet Chapter 3.2 XCVMPD, then I think is the first entry here. You have the, this is Chapter 3.2 of XCVMPD, Chapter 3.2. This is like kind of the Bible for XCVMPD. Mostly at the end of this document, you have this diagram where it is explained which are the products for which the pack sizes should be submitted, depending if it's a centrally authorized product, yes, no. If it's a non-cap, then what happened, yes, no. And here you have how the data should be provided. If you also look for package description, there are many entries here. Here it is explained how the package description should be provided, and it gives you some examples. Okay, so this is what you can do. And wait 1 second, let me. I'm not sure if this is the latest one. Package description. Yeah, so here you have some information on how you can provide the, it is the same document, sorry, how you can submit the package description. So for example, here you have the national identifier plus the pack size plus then, for example, the material. And this is another example where you have the national ID, the pack size itself, so 60 parses, and then you have the material as well. You have different examples on how this data can be submitted. There is also a webinar, and if you you can look for it in YouTube, in our YouTube channel. There is a webinar on the pack size submission, and there are also examples. There is also a bit of a video showing how you can do this in XMPD and how you can find the information on how to submit the package description. So there are many places, but this is kind of like a Bible, the chapter 3.2, you should be using this one. And
Okay,
yeah,
perfect.
back to you.
We'll start sharing again. Okay, there we go. I should be able to see my screen in a second. Okay, perfect. So next question. When will you release a new ULCM list?
It's already released. So that is not the union list of critical medicines is not so it's not on our team. We are not the one responsible for releasing this list, but it has already been released. And if you also look for union list of critical medicines EMA, I think it's the first entry you see. I'm gonna share again so you can see it. Okay, so if you look for ULCM EMA, the first entry that you see is this one, union list of critical medicines. And here you can see this Excel that was updated on the 12th of December. Okay, if you open this one, and again, this is not our responsibility, okay? It's a different team, DMA, but it's not PMS. So here you have the new list of ATC codes and route of administrations, and it says when they were included. So I think they have included a couple of ATC codes, like this one, for example, it was included in December 2025, etc. So this is what we consider the union list of critical medicines. Now, I think it's this week or next week, they will update this Excel. They will release the version 2.1 review 1, just to include here in the root of administration the word use at the end of each term, because this is what is blocking our BI report to work properly. Okay, so as soon as this Excel is working, then the BI report that allow you to see, okay, from my medicines, from my products, which of them are considered critical based on this report, then it will be updated and it will be working. So I hope that gives you a bit of information on where to find the information.
Perfect. Thank you, Marcos. I'll take over again. Okay, so next question. PMS Data Enrichment's FAQ says that UK products do not apply. Please confirm if by UK this extends to UK MAs, which include products available in Northern Ireland. I was advised that XCV MPT pack sizes applies this to UK licenses if products available in Northern Ireland.
So the ESMP team, that is the one that is using the enriched data from PMS, already told us that products authorized in UK and also Northern Ireland are not in the scope of the data enrichment. They don't need this information. So it was already confirmed by them. Now, if you, of course, XMPD rules still apply. And if you have a product that is authorized in Northern Ireland, then you need to submit them. You need to submit these products to XCBMPD. Now, if you don't want, you don't need to enrich them. You don't need to submit the manufacturers. That's fine. But the data should be in XMPD. So the product and the EV codes should be submitted to XMPD because those business rules still apply.
Okay. Next question. Could you kindly confirm that the new RMS team added in the manufacturing activity list are not in the PMS scope?
Okay, so maybe to give a bit of background, there the manufacturing business activity, the MBO list from RMS has been updated. Was updated by the end of last year, and there are two new terms that have been included related to the cell banks and the cell bank preparation and things like that. There are two new terms. I have asked the team, and in principle, these new terms are not applicable to PMS. So you don't need to submit any of this data to PMS. And that's why we have not updated chapter 3, where we have this table with the relevant MBOs that are applicable for PMS. If we receive a different requirement, then we will update the document and we will let you know. But so far, even if the RMS list has changed, there is no changes on the requirements for PMS. So you don't need to provide this information to PMS for the moment.
Okay, next question. Could you please clarify if it is advisable to always track the authorization status and status update at both levels, so prod and pack?
Yes, so ideally, yes, because you might have different dates for the product and for the package. So the authorization status, obviously, you can have a valid product with 3 packages, 1 that is valid and 2 that are withdrawn. So you see there are different statuses um, uh, for the packages and for the product. And with the dates, it can be the same. So you can have different pack sizes or different packages authorized. Like today, I authorized two packages, and then next year I will have a variation to get 2 new packages authorized. And then the status date will also be different. So you need to track this information for your product.
Okay, next question. Regarding enrichment of MBO start date, we have API manufacturers registered but not supplying API yet. Some of those are not validated and API could not be used for manufacturing. In such case, could MBO start date be left empty?
Um, Wait, I need some of those are not validated. Um, so here is a bit of the question is if this manufacturer is authorized or not. And that would be the question. I don't know if this is not validated means that it's authorized, but it cannot be used for for manufacturing. If it's authorized, then you need to provide it. It's okay. It might not be used for the manufacturing, and instead of leaving the start date empty, this is already explained in chapter 3. You can use the start date when the product was authorized. So instead of leaving it empty, just put if you know when the manufacturer was authorized, use this date. If you don't know it, use the date when the product was authorized. Because it doesn't matter if the manufacturer is not manufacturing. The important thing is that it is authorized. So, and the MBO start date makes reference to when this MBO was authorized, not when the manufacturer is started to manufacture. So I hope it's clear, a lot of manufacturing things, but don't leave it empty. Use the the authorization date of the manufacturer if you know it. If you don't know it, the authorization date of the product.
Okay, next question. Regarding the varied renewed query asked earlier, you said yes. Can you clarify whether you change the status to correct one or remove the invalidated codes from PMS ID as we used invalidated EV codes as previous EV codes during renewable sub?
Yeah, so we will follow a similar approach to the one that we use for the transfer. So we will, yeah, it's not remove, but you will not see them in the UI, the ones that are invalidated. So those CV codes that says not valid renewed will kind of disappear from the UI because they will be replaced by the ones that are valid varied, I think they are called. It's a similar approach to the transfer process.
Okay, perfect. When the merge presentation issues in PMS PY will be resolved, currently we have CAP products case where two representations, pre-filled syringe and pen, are merged under single PMS ID, and a ticket has already been raised for this.
So this one we need for caps, we need to check case by case. So it's not a general bug. It's this might be an issue on how Siamet is capturing the data. So I've taken note of this incident because this is yeah, it's not a general issue as such. It's a specific issue for this product, and we need to check with the Siamet team because there might be a data quality issue on their side. So I'll have a look at the ticket.
Okay, next question. Structured package data. How to provide information on packaging materials such as glass bottle with screw cap and co-packed dosing spoon. How to provide information on IDDCS.
Well, for the moment, you don't need to provide any of this data because the enrichment of the materials and the packaging materials is not allowed. So yeah, I cannot reply on this. Now, if your question is because you are somehow capturing this data already in your RIMS, etc., that we need to discuss. So I've seen also a couple of questions in the RMS colleagues asking like, hey, when are you going to start reviewing the material list or the container list or things like that? We need to receive the requirement or we need to start discussing these points and these lists and how this data is going to be provided, but only when we receive the requirement that this data is needed or whenever we get rid of XMPD. So For the moment, I cannot reply on how you should provide this information on packaging materials, if you have a glass, whatever, because we still don't know which is the granularity that we will require. So I'm sorry, but for the moment, I cannot really provide an answer on this question.
Okay, next question. In the last Q&A, it was announced that the grouping rules will be changed for
I
PMS
think we
regulation. Oh, yes,
replied
this
to
is
this.
similar. Yeah, yeah. Same. We have more than one manufacturer per medicinal product. However, we were only able to add one manufacturer per medicinal product in PMS. Is this a common known problem?
No, and that shouldn't be a problem. So either you are doing something wrong, or mm, or yeah, but because that's not how it works. So whenever you edit a product in the product UI, you can enter a manufacturer, you can then put the manufacturing business operations, and you can include a new one. Whenever you click on, I don't have one open now, and it will take some time. We don't have a lot of time. So the idea is you can say add new manufacturer, you can select the org ID or the log ID for this manufacturer, and then you can click Save a New, and that will save this manufacturer and will allow you to create a new one. Or you can just save the one that you have entered. You can go include the business operation for this manufacturer, and then you should still have the button saying New Manufacturer, like add new, and you will be able to add a second manufacturer, and then you can add a third one, and you can add as many manufacturers as you want for the product. So yeah, I would recommend you to check the user manual that is in the PLM portal, like the navigation guide on how to use the product UI. And if you still have any question, raise a question to the product UI team, and they will be able to guide you also with maybe some screenshots, etc., on how to do this. But yeah, you can add more than one manufacturer for sure.
Okay, next question. MBOs for ULCM products, CROs used in MAHs of some older products are no longer active existing. For instance, studies that are dating back to 2010. Sites not in OMS. How to register these sites and prove their existence, or skip them in MBO enrichment?
Um, so that's a good question that I don't have an answer for. Um, I will check with the team. So there is this referrals team. I will check with them, and I'll try to, maybe we can include this in the Q&A document, this question and the answer. But I don't have the answer, so I need to check internally.
Perfect. Does the same concept of better not to leave empty the start date for the manufacturer apply to the CRO?
Yeah, so the dates, that's what is explained in chapter 3. When we were discussing the start date, we received a comment from the SME saying that there are some old products for which the marketing authorization holders don't have all the information on it. It would be very hard for them to find when a specific CRO was approved, or a specific study was done, or a manufacturer was approved, etc. So we said, okay, for those products, those legacy products, the old products, the start date can be the one that is the authorization date of the product. Now, for new products, you should know this information, so you should include the accurate date.
Next question, just to understand if I got this. So for the granules for oral solution in sachet in the PMS, it is reflected in the same way because it is part of the combined term list and not the pharmaceutical dose form list.
Yes, so let me granules for orals. Let me, I'm gonna share again. Mm. So if I hope you can see this. If in RMS you look for a granules oral solution in sachet, you have this term, okay? And this is part of the combined term. This list is a list that can be used in PMS. I can also give you here UIG. If we go to chapter 2 and we look for the authorized dose form, the combined now. The authorized dose form can be from the combined pharmaceutical dose form list, for the pharmaceutical dose form, for the combined term, and this is what we have the combined term, the granules for oral solution in sachet. So this list can be used to refer to the pharmaceutical dose form. And if you see here, the mapping is mapped to the XCVMPD term with this. So the answer is yes, you can use this term because it's a combined term from RMS. It's also a standard term. You see, it's a standard term from EDQM with this value, so you can use this value. You don't need to change anything.
Okay. Next question. Okay, so regarding the varied renewed case, you mentioned that EV codes with not valid status won't be visible in PUI, but we can see some PMS IDs with non-valid status for some EV codes at PMS level.
Yeah, that's the thing. We need to make this change. Maybe for the next Q&A, I can explain you where these EV codes at medicinal product level it's come. But this is package. I can explain maybe where these EV codes from the UI are coming and which ones you need to take into account and which not. But that's the thing. For these varied renewed cases, we need to make some changes, and this will be changed. You can see them now because it's wrong. I mean, there is kind of an issue there, but this will be fixed.
Okay. Next question. When will it be available, the capability to submit data to the packaged medicinal product session for CAPS products?
Not yet. We are not even contemplating this possibility for the moment for the enrichment. So we are not contemplating this. So if there is anything that you want to change that is not part of a known issue, then you need to raise a ticket. But otherwise, for the moment, caps will not be. You will not be able to change any data for caps.
Okay, next question. The manufacturer produces a starting material for the active substance. Which spore term should be selected at PMS for
I
MU
think
enrichment
I replied to
activity?
this again.
Yeah.
Chapter 3, it only says intermediate material, intermediate active substance, and product. So nothing for the starting material.
Perfect. Current concept of full portfolio visibility to all users creates problems when working with third parties. When will the PMS be enhanced with the functionality to limit the visibility of products to groups, as in XCV virtual affiliates?
Okay, so well, the virtual affiliate is a bit of a different concept in XMPD, but I know what you mean, and I know what this portfolio management, what you want to do with this. So for this quarter, we will try to do a bit of analysis on what would be the cost, like how many months would we need to implement this feature in the product UI. Because then we need to discuss with management which are the priorities for the product UI. If it's this portfolio management or if it's the new product creation through the product UI, etc. So I cannot tell you when this is going to be available. because we need to discuss again the priorities based on the different features that we want to bring to the product UI. So just please bear with us. As soon as we have more information, we will let you know. We know this is something. I mean, every Q&A we receive this comment, and we know this is something that people is looking for. But we need to discuss with management, because with the resources that we have, we need to see what makes sense to prioritize.
Okay, next question. And then in a few minutes, we will launch also our feedback survey as usual. So in PMS, for an MP, version number and last updated date is displayed. It would be useful to see if the update was made by the MAH or by EMA. Also, the assessment status is valid with edits and valid as is would be useful to see. Thoughts on this?
It would be amazing. The problem that we have is that right now we are not capturing this information from in PMS. Um, I would say, and I think to be honest, it doesn't make sense to invest now in having this information displayed, because we will get rid of XMPD at some point. I think it makes sense that we implement something like this whenever PMS is the single entry point of data. So we know, okay, this version has been changed or not by the DMA holder or EMA. But right now, it would be a lot of effort to understand, okay, this version is coming from XMPD. This version has been submitted by the applicant or by EMA. It's a lot of effort, and I think there are other things that we need to focus more than this one. I think it's a really good idea, and if I had like infinite resources, I would implement it, but I don't have it. I don't have those resources. I mean, I have resources, but not infinite resources, so we need to prioritize, and I would prefer to do like merge packages on these multilingual countries, things like that are more important and are really issues compared with this. But I think it's a really good idea to have this. But again, resources, we need to play with the resources and prioritize.
Perfect. Okay, so just to confirm, colleagues, we've launched the feedback survey. So as usual, it's always really important for us to receive, your feedback, how satisfied you were with the sessions, for of course improving these Q&A clinics, even more every time. So thanks for that. Okay, so moving on, we still have a few minutes for some last questions. So one of our transferred medicinal products appeared in PMS API, but not in PMS PY. We've raised the ticket and plan to use a web-based form. Is there anything we should consider for future submissions in similar cases?
So first, we need to understand why you can see this product in the API, but not in the product UI. So I don't know if you've checked, for example, the holder, if you've checked the status, first of all, because I'm not sure if the product is nullified, for example, then for some reason it's been nullified. You can see it in the API, but you cannot see it in the UI. And maybe there's another product, with the status current that you can use. So that's the first thing we need to do, investigate why you cannot see it. If I had the ticket, then I would be able to check it myself. But and then consider for future submissions. Yeah, well, that's the thing. You need to make sure that the product is in the EAF side, so it can be used. And check the statuses and things like that. There are things in the API that you can see that you cannot see in the UI, like these nullified products. Or for example, products with a missing dose form. You can see them in the UI. You cannot see them in the you can see them in the API. You cannot see them in the UI. But this issue was fixed, so that doesn't matter. So check the status, please. And we need to check which is the product that should be used, because there should be another product for sure.
Okay, next question. Package description should contain control digit or national code in Spain. Thank you.
Good question. You can do it because in CIMA you have the code, the digit control code, I think, so you can use it. Again, the package description is a voluntary thing, it's an optional thing. If it's useful for you, go ahead, include the control digit. If not, you can just keep the El Código Nacional without the control digit.
Okay, next question. Some of our MHs appears as valid in PMS, but they have actually been withdrawn and the corresponding invalidation messages sent to XCV MPD. Is there something that we should have done?
No, most likely you've done it correctly, and the issue is with the integration between XCMPD and PMS that we are working on. Open a ticket so we can see why the invalidation has not been propagated to PMS, and we will, if needed, we can, update PMS with the relevant information.
Okay. Next question. With respect to the CRO, previously you have confirmed the following in my understanding. If the CRO is not in OMS or it does no longer exist in the organization, is it to be considered as no longer authorized?
So the problem here is that the CRO itself is not authorized or not. So at least from the knowledge that I have with the discussions that I have had with the internal colleagues is that these CROs were responsible for the bioequivalent studies. So they were the ones performing those studies. So there's nothing authorized. It's just that this company was used for a specific study. Now, what happens if the organization doesn't exist anymore? How to include this information in OMS? Do we include an OMS organization that is invalid because it doesn't exist anymore, etc.? I need to discuss internally how do we manage this information. That's why I cannot provide more information. But it's not that it's not longer authorized. So that CRO that doesn't exist anymore performed a study at some point. How do we track this in PMS? That's what I need to ask.
Okay. At the time of full data enrichment, CAP will also be allowed to be enriched or only non-CAP?
No, the idea is that everything will be subject to a full data enrichment because we need the full data model for all the products. Now, we will include
Sorry.
restrictions. Yeah, it's like we will put restrictions that for caps, you cannot change specific fields that are already in PMS, most likely. But most likely that also will also be the case of non-caps. So we don't know yet. We've not gone that far into the discussions, but yeah, we will need the full data model for all the products, and MA holders will have to provide it at some point. Also, we don't know if it will be a big bang approach that you will have to provide everything, if we will be opening specific parts of the data model. This is still subject to discussion.
Okay, and here actually a user has provided us with their ticket number. So it was the question regarding the product not visible in PMS PUI, but visible in API. Okay, so we've got that information there. So we can look into it. Okay, so to this then. The filter on EV code was removed from the dynamic report, for instance, products of my organization. Would it be possible to add this filter again?
I will check because that's weird that it was removed. So I will check. We have not removed any filter from the product UI or from the dynamic report. So yeah, I will check with the team.
Okay. Next question. Why am I not able to filter products in the dynamic report by full name? I don't see it there at all. Thank you.
So yeah, again, it's the first time that I hear this. I would recommend you to open a ticket for the product UI team. So whenever you open a ticket, instead of saying PMS, you select PLM Portal Product UI. And if you can include some screenshots, they will help you with this. And we have fewer tickets for the UI, so you will be able to get a faster reply. So it should be working. It's the first time that I hear that that specific one is not working.
Okay, I've got still a couple more minutes. So what is now the process to update the lock ID of the MAHs, change from inactive to active? OMS is up to date, XEVMPD org ID up to date. What can I do to update the medicinal products with the correct lock ID in PMS?
So you need to submit a dummy update to XEVMPD, because then the system will be forced to take this new mapping between XEVMPD and OMS. Yeah, and then the lock ID will change in PMS. So what we are not doing is, because you make a change in the mapping between XCMPD and OMS, then PMS is updated directly. We are not doing this. You need the system needs to get a new message so the new mapping can be taken.
Okay. The packaging material is defined in the SMPC as composite, internal layer in material A and external layer material B. Composite is not listed in the RMS list, but materials A and B, yes. How should be described, defined in PMS?
So that's what I said before. I'm not able to reply to this because we have not discussed yet the materials with the SMEs and how granular we need this information, and how granular NCAs and EMA will need this information. As soon as we get this discussion, we will be able to provide more information. We will be able to maybe include additional data in the RMS list. Maybe composite will be part of the RMS list, or maybe not. I don't know. But until we don't have these discussions, we cannot really provide additional information.
Okay. Will there be a training course on how to use PMS API?
So not really. There has been a webinar on how the PMS API works, which are the endpoints, etc. But the API is such a technical component that there is not really a training on how to use it, because normal users shouldn't be using the API as such. Your technical colleagues should link this API with a system, and then you should be trained on that system. That's why we've made webinars for the API, how to connect, how to call the API, etc. But there are no training courses on how to use the API.
Okay, and last question. We have products in PLM PY without marketing authorization number. Also, when we make an update in XCV MPD, it will not be transferred. Shall I open a ticket?
It depends. You need to, so the FAQ document of PMS already explains this, and also chapter 2. If all the pack sizes of your product have the same MA number, then the product will have this marketing authorization number. If you have multiple packages with different MA numbers per package, then the marketing authorization number at product level will be empty. So you can send thousands of updates to XEVMPD. It will not change anything, because if you have different MA numbers per package, then there's no MA number at product level. So check if your product falls into this category, and that might be the reason.
Okay. So, Marcos, I think we've finished our time, so I'll leave it to you to close. Thank you.
Yeah, well, as always, thank you very much. I assume there are still a couple of questions to be answered, but yeah, there will be another Q&A session next month. In the meantime, please keep an eye on the documents. Most of the things that you are asking here might be replied if you check the documents. We know there are a lot of documents out there, but please have a look. And still, if you have questions, you can raise them also through ServiceNow, opening a question, or you can also come back to the Q&A sessions that we have every month. So thank you very much, and see you around in the webinars that we still have. Bye bye.